So what are the side effects of Kuvan? I mean, we know every drug, you know, even those that are great, do have side effects or adverse effects. In the clinical trials, no serious side effects were identified with Kuvan. It had an excellent safety profile. There are some mild side effects, though, and these are primarily gastrointestinal or GI. What I've observed in the patients we've started on Kuvan is that most tolerate it completely fine, no problems, no complaints whatsoever. But occasionally we'll have somebody who experiences some gastric upset. The drug is acidic, and so we think it's related. It can be heartburn, nausea, vomiting. I've seen a couple patients with diarrhea. The ones that had diarrhea, I just said, let's continue it, see what happens, and it basically resolved within 1 to 2 weeks without doing anything different. In the ones who have a little more stomach distress, we recommend giving it with food or formula, and we now recommend that to everyone to avoid that. And really, we see that that is helpful in averting the side effects in most people. So I've not had any patients in whom they had side effects that warranted discontinuation of the drug. So they're always short-term, mild, and have not seen any other significant side effects besides that. What about the cost of the drug? Well, it is very expensive. Everybody's heard it's very expensive, just like basically all the other orphan drugs that we have to treat rare diseases, where there are huge costs of getting to the FDA and then a limited number of patients on whom to spread those costs. Our experience is that insurance carriers are typically paying for the drug. We have not had serious issues with that. And there are safeguards in place to ensure that any patient who could benefit from the drug will be able to get it, regardless of insurance issues. There is a financial assistance program in place through the National Organization for Rare Disorders, so that if we have a patient who does not have insurance coverage for Kuvan, maybe doesn't have any insurance at all, or they have problems with that, they can apply to that, and the vast majority of patients are able to get coverage through that program. If that falls through, then there is a second patient assistance program available through the company. So there's really no one in my practice where I've suggested trying Kuvan that we've not been able to do it for financial reasons. So in summary, Kuvan is effective in lowering blood phenylalanine levels or increasing Phe tolerance in the diet in about 50% of patients with PKU. All patients should be tested for responsiveness to Kuvan. And I think as we get into this new era of drug therapy for PKU, it's tremendously exciting, because our whole concept of what we're going to be doing in our clinics, how we're going to be treating patients, is changing 180 degrees. We now have Kuvan. We are doing the clinical trials for PEG-PAL, which in theory should work for everyone. In best of all possible worlds, we may even be able to normalize blood Phe levels on a normal diet. Time will tell what the adverse effects might be, or if the drug is in fact that effective. But it's a very exciting time, and in the future, I think that drug therapy for PKU is going to be largely pharmacologic. In other words, this drug or a combination of drugs augmented in some patients, not all, by some dietary or nutritional intervention as well. So we're going to be looking at combination therapies just as we do for many of our other chronic conditions. But these therapies hold the promise, I think, for improving outcomes so much in patients with PKU that it is really a very exciting time. So I'll end there.